Hi, it's Dr. Nathan Saydyk, and I want to continue our series on systems in a dental office. The next logical system in my mind is this scheduling system. Now that you know that how to answer the phone and you're getting new patients in and existing patients are scheduling for treatment, how do we put these people on our schedule, and how do we make sure there's room in our schedule for growth, and how do we make a productive schedule? So think of scheduling systems you've been exposed to in the past. A lot of the ones that I was exposed to early on were very poor. It was put as many people in the schedule as you possibly can. Don't pay attention to time and just pack them in there and try to put the most on the schedule. And hopefully at the end of the day, that will be a productive schedule. Didn't always work out that way. Ended up creating a lot of stress, non-productive, angry patients, upset staff, burnout. Very frustrating without a plan. You might get lucky because you might have a really good person up front that knows how to schedule, but what happens if that person leaves, right? He goes on vacation or whatever. What happens to your schedule then without a plan? How do you train the next person into your office? Also, more often than not, you're gonna have days that are super busy and then days that are dead. Days that are super productive and days where you felt like you paid to be a dentist by the end of the day. A schedule where for the next couple weeks you're packed absolutely full, and then after that it is just absolutely empty. And a schedule where people have to wait a couple weeks to get any kind of appointment whatsoever. So it's not built for growth. Maybe a hygiene schedule that's so packed full that for the next 6 months you don't have room for a new patient. So how do we even all this out? How do we get this good schedule that's productive, not crazy, able to accommodate patients and run on time, and leads to a more happy workplace? How do we make that a reality? In my office, and the way I've been taught over years, it starts with you have to set a couple goals, right? Goals are the basis for your scheduling system. And these are realistic numbers that we can break down and use to guide us to make sure we have a super productive schedule. Sorry, there's some mosquitoes around here. I got to swat every now and then. The first number that we need for this is your hourly goal as a doctor, as hygienist, as an office. How much do you want to be making producing per hour? How much do you want your hygiene to produce per hour per hygienist? There's a couple ways to calculate it. And the reason we like the hourly goal is it's understandable and you can break it down really easily. It's a bite-sized thing. If you look at a yearly goal, it's a great idea, but it has no legs to it. Even a monthly goal is great, but how do you guide your actions every single day to get a monthly goal other than just to pile crap into the schedule and try to get there as fast as you can? So one way to calculate your hourly goal if you're currently working is super simple. Take your current production for a month or 3 months and then divide it by the number of hours you were available to work in that time frame. So if you were open 8 hours and you could see patients, even though you only saw 2 or 3 patients that day and a lot of the time was empty, you divide that over the hours that you're able to work, and now you have what you existing are making per hour as a doctor. Do the same thing for your hygienist per hygiene. How much did the hygienist produce over a month or 3 months? Divide it by the number of hours they were available to work. That is their current hourly. Another way to do it is to take the entire office production for that time and then divide it by 70% for the doctor, 30% for the hygienist, because that's roughly what hygiene and doctor should be producing out of an office, and then do the math to get the hourly that way. But you want to get that hourly goal. Another way to kind of look at this too is to say, what is my yearly goal? How much do I want to be making in a year in my office? You can get that by taking your hourly and multiplying it by the number of hours you're going to work and adding it up over a year and saying, well, that's what, based on historically, that's what I'm going to be making this year. Now you can take that and say, is this what I want to be making? Or if you want to make more, bump it up 10% and divide that out by the number of hours you're going to be working that year. So you can kind of work your way back into that. Do it in an Excel spreadsheet, do it a couple different ways. Do what you're currently at. Imagine what you'd actually like to be making, divide it out, see how far those numbers differ, maybe set some stepwise goals to get there. Another great number to know to compare here is what's called the BAM goal, the bare ass minimum. This isn't really a goal, this is a hard deck. This is all your fixed and variable costs, including the doctor's paycheck, and divide that by the number of hours you're working in a year or planning to work. And now you know hourly what you have to make in order to just cover your costs, right? This isn't a goal, this is just your hard deck. You need to be here. So now you have a range from bare ass minimum up to your goal and your hourly somewhere in there. And you can use this to guide you in bonus setting and in scheduling, right? A bonus goal is another one I do per day and also for the whole year. What are my bonus levels going to be? Use an Excel spreadsheet, calculate it all throughout that entire year, and get that number somehow, get a goal. Now, when it comes to actually working your schedule this way, we're going to use something called rock, sand, water templating. The idea is this. Imagine you have a great big glass container and you have a bunch of rocks, a big pile of sand, and a big bucket of water. And you need to put everything in, as much as you can, into that glass container. If we take water and fill the container up first with water, the moment we try to put sand or rocks in it, it overflows, right? We can fill it up with sand and then dump the water in and fill in with the water, but the moment we try to put that rock in there, it overflows, it doesn't fit it, right? But if we start with these rocks and we put those and fill the container with rocks, and then we dump sand in and shake it around to get the sand to fill, even though it looks full, we can now dump water in and fill that all the way up. So it's the order in which you do these things. Now, how does this relate to your schedule? I'm sure you can probably guess here. We want to call these high production appointments rocks. We want to schedule about 3 high production appointments per day. So how do we know what a high production is? High production is 2 times your hourly goal in an hour. So if your hourly goal is $500 an hour, you want to be making in this appointment $1,000 per hour, and that is a rock. If you have 3 of these rocks during the day, templated out and blocked out, nothing else can go in that appointment except for something that meets that value, and you get all 3 in a day, that's about 60% or more of your goal in just 3 appointments of that day. Sand appointments are not these high value appointments, but you're still making money. It is above your hourly goal up to that 2 times your hourly goal in an hour, right? These are your smaller filling appointments. These are, just 1 crown, something simple like that. So you block these out as sand appointments, and a lot of times you can use them in conjunction with your rock appointments, right? So if you have a rock appointment that's almost 2 times, but not quite, but there's a natural break in that appointment, like you're milling your own crowns, there's a natural break. You can put in a sand appointment, and now that whole time frame has become a rock for you, right? But you fill in next with the sand appointments, these ones where you're still making decent money, and leave those open or schedule them out. And now around all of that is where you fill in the water appointments. A water appointment is a low value appointment. So this, or a low production appointment. This is something that's below your hourly goal. So when you take this appointment, you are moving away from your goal for that day. It's still necessary work, small occlusal fillings and everything, just the little work you have to do. Some of them are no cost whatsoever, follow-ups and everything that aren't going to produce anything, so let's not fill our day with them. Let's fill our day with rocks first, sand second, get to our goal, and then fill these little things around on these days. So when your team goes and templates these out and puts blocks in your schedule, now when they go to schedule people, it's not like where do you want to go, or they start filling people in. They template out their rocks. So now over the next week, you have a much more stable production. Make sense? You also want to template out high value, low production appointments. A high value, low production appointment is going to be like a new patient appointment. That's high value. Emergency, that's going to be very high value. You need to have these appointments. They're valuable for your patients. They build relationships, but maybe they're not the most productive. So you also need to block these out both in hygiene and in the doctor's schedule. If a patient calls up and they can't get in as a new patient for the next 3 weeks, you're probably going to lose that patient. So you need to have these blocked out. Another high value, low production is an aesthetic seating case where you're putting in the crowns, aesthetic crowns or a full reconstruction. You've already got paid for this case, but you have to finish it. It takes a lot of time to do these. And if you set aside time, you can make the patient feel comfortable. You can do a reveal and record it, and you can leverage it for social media and for advertising so that you get a lot of value out of this appointment, even though you didn't produce as much. You can leverage it in other ways. That's going to help build your schedule in the future. The blocks that you put into your schedule are honored 2 to 3 days before. So you leave it open, and 2 to 3 days before, if that's not filled, now you can fill it with anything. One of the best ideas is try to pull rocks from later in the month earlier. Ask people, are you flexible in this? Can you move a week up? See if you can move next week's rocks to today and open up that time in the future to use time today. Because time is the most valuable commodity you have. Once it's gone, you'll never get it back, right? Or just start filling it with whatever. Another important concept is, as you're going through and they're scheduling for this month, if your day, let's say I have a rock appointment in the morning, and that is a very high production appointment, and that one appointment covers my entire goal for that day, right? My daily goal is just my hourly goal multiplied by the number of hours I'm working that day, along with whatever hygiene's goal is. And it's up at the very top of all of our screens on every single day. We enter that in so we know what it is. So as the front office is scheduling, they're going to look at the schedule and see, when they're looking to put somebody in, if I have a day where I'm already producing my goal, and the next day I'm low, don't put them on today. Put them on the next day, right? That way that day now I'm up to goal. And I have open time in my schedule today, even though it's just one patient. I can see emergencies. I can also put in those lower value appointments, the seating appointments, open it up for emergencies, pull people over from hygiene to get work done. If I find something in hygiene, I can just do it that day. Now that high production day becomes even better because I had room to do stuff in, right? And it's okay to have a day where I produce a bunch and then hang out and do hygiene. And even if nothing comes over, it's okay. The next day I'm producing well too. And have that even production over time. So that's the idea of perfect day scheduling. Calculating the hourly goal, and we talked about a couple ways to do that. Using that hourly goal to identify the different types of appointments. And then blocking that time out in your schedule so that as your front office is taking these calls and scheduling things, they now know how to put stuff in so that we have an even production. And if we do this, we are more likely to hit our monthly goal than if we just have these busy days and slow days, and we'll be much more sane at the end. The next thing we'll talk about is kind of standard operating procedures for your appointments. When people come into your office, what are the different ways they come in? And then what you're going to do during every one of those appointments and detail it out. This also has to deal with what's very important, what's called your new patient experience. We've already set up all this great stuff on the phone. We've pre-prepared for them to come in. Now, when the patient actually walks into the door, what is every step of this going to look like in order to build a relationship, identify problems for the patient, present it properly, and ultimately the goal is to get them to schedule and schedule for treatment. They want them to come back and we want them to get their treatment done. And those are some of the KPIs we're going to look at with those. So next we'll talk about new patient experience. If you have any questions about the scheduling and goal setting or anything, let me know. I can share an Excel spreadsheet that I use to track all this. I know you have, we have Practice by Numbers and other great programs like that do this for us, but I still use my Excel spreadsheet to help goal set for everything for myself. And I set the goal for the entire year right about now. It's November, so I'm gonna make sure next year is completely done August, November, so that we're prepared come January to hit the ground running. Anyway, like and subscribe, and if you have any questions for me, hit me up down below or hit me up on my social media. Thank you.